Halloween. It's Live with Dr. Nancy at lunch. I'm in my SpongeBob outfit today. So this is my yellow shirt that you see. Today I'm so excited to have with us a fertility specialist. So what I'm seeing in my practice is more and more moms that are having a hard time getting pregnant, or women in general. They're really having a hard time getting pregnant. I really believe a lot of it has to do with, people starting birth control early on and, as teenagers and early 20s. I think it's really messing with our hormones. So fortunately, there's alternative methods out there about family planning. So today I'm going to introduce Chavah Hull. I probably said her name wrong again. And she's going to talk to us about a natural way of family planning. So welcome.
Hi, thank you so much for having me. Like Dr. Nancy said, my name is Chavah Hull, and I am a fertility care practitioner. I'm currently in my internship year, but I teach the Creighton model system. And so there are a few different types of family planning methods. You can have symptothermal, which is what most people are familiar with taking your basal body temperature, or there's just mucus systems. And so Creighton is based specifically on cervical mucus, any type of discharge that you see. And with Creighton, it's all external checks. So there's no internal checks. And so that's something different that sometimes you get with other methods is internal checks. Sometimes that can be a bit intimidating. Yeah. So Creighton has only external checks, which is nice. And we're only concerned with the cervical mucus. And so a mom typically, or a woman, not necessarily a mom, but any woman, once you hit puberty, all the way through premenopause to menopause, and a typical cycle will have a fluctuation of discharge present. And that cervical mucus actually tells us a whole lot about your body. And sadly, most women and girls have lost this knowledge altogether. And so it's my pleasure to help kind of re-empower us as women to know our bodies, to know our fertility, and just have a say in our own gynecological health.
So this is good for somebody who's not even necessarily family planning, right?
That's right. So as soon as you hit puberty, your hormones start to try to regulate. And what you see in a typical cycle is after you have your period, so you have 5 to 7 days of bleeding, then you will go to a set of dry days, and then you'll have cervical mucus that comes, and that corresponds with estrogen. And so your dry days, and then when you start to see cervical mucus, you're having an increase in estrogen. And then as your estrogen drops and progesterone starts, the progesterone is actually the hormone that gets rid of our cervical mucus. And it just changes it. So then you don't see any cervical mucus externally. And then as the progesterone increases and goes, when the progesterone drops, then you'll have another period. And so Creighton and learning to chart can tell you so much about your body. Yes, it does tell you when you're fertile and when you're infertile. And so if you're trying to achieve a pregnancy, you would choose to be intimate on fertile days. And if you're trying to avoid pregnancy, then you would choose to be intimate on non-fertile days. But regardless, if you're not doing anything, if you're a single woman or you're a young girl, then you can still use Creighton to chart to just learn about your own body. And it'll start to tell you about hormone issues or other things, like if you're struggling with endometriosis or if you're struggling with PCOD, all of those things with PMS. So like you mentioned, Dr. Nancy, a lot of doctors, when a mom brings her daughter into the office, or you're going off to college or in high school or whatever, and you may not be sexually active, but you're really struggling with PMS, you're having heavy periods, you're having strong cramping, you may be having breast tenderness, things like that we associate with PMS. Most of the time, it's a hormonal imbalance. And so what you're typical doctor, your traditional doctor does is prescribes birth control, because what the birth control does is it gives you artificial hormones to help, quote unquote, regulate your cycle. And I just wrote a blog post on this. It's a myth. Does birth control regulate your cycle? And the truth is no, but it's confusing because you say, well, but I have a period every 28, 30 days. How is that not regulating it? And what the hormones do from the birth control is they suppress the natural cycle in your body and the natural hormones that you would see. And so fertility care practitioners, those who teach Creighton, we partner with doctors who have been trained to specialize in Creighton in charting. They're called NAPRO doctors. NAPRO technology is the medical term there. And we partner with them and we help a woman or girl to chart. And then you take that chart into your doctor and they can see, it's crazy. Our mucus will tell us if we're having issues with our estrogen, if we're having issues with our progesterone. And then the doctor can pinpoint those specific areas that need help in your body and then help your body to produce that naturally versus using the pill that is not natural, so that when you go off the pill, you're going to have the same issues that you had going on the pill.
So when do you suggest people start seeing a fertility practitioner like yourself?
It's great when we can get moms bringing in their young daughters, middle school, high school, to learn just about your body. Now, I typically start seeing the majority of my clients when they're in their, early 20s, mid 20s, 30s, when they're thinking about starting a family. And a lot of the women that I work with have been on the pill previously. So then they come off the pill and then, like you said, they're struggling to become pregnant.
Right.
So trying to find ways to achieve pregnancy naturally versus doing something like IVF or infertility treatments or things like that.
Right.
And so ideally, a girl can start, like I have 4 daughters. They're all very young right now. None of them have hit puberty, but we talk about cervical mucus all the time in my house. Like we talk about menstruation. I'm also a doula and childbirth educator. So we talk about birth. We cover the whole gamut. Whoever marries my daughters are going to get a whole lot of education. But all that to say, ideally, we need to start teaching our daughters and girls about our bodies a lot earlier than we have.
So what does a visit to you, what does it look like? Like the initial visit, is it multiple visits? Is it one visit? How does that work with you?
So it starts with an introductory session. An introductory session lasts it's about a 90-minute appointment. And typically those are done in groups with other couples. And that's just to lay the foundation of what is fertility, what's actually happening to my body, what does it mean when I'm menstruating, all those things that we should know as women because, well, it happens every month and it, is a natural occurrence, but for most of us, we're completely oblivious to what's actually happening there. So we set the groundwork and then we give a little bit of introduction into Creighton itself, what it looks like to chart, how you do your checks, what cervical mucus looks like. And then we do a follow-up and after the intro, every follow-up is done privately. It's just you and either yourself or your spouse or your partner can come as well. And then for the first 4 sessions, we actually meet every 2 weeks, which seems like a lot, but there's a lot to learn. And one of the reasons I chose Creighton, so I tried a lot of different natural family planning methods for my own self. And then I came across Creighton. And one of the things I love about Creighton is it's very standardized. So for a practitioner, I mentioned earlier, I'm in my internship year. That's actually a 13-month internship and supervision period where I have 2 separate on-site trainings where I'm there for a week at a time. And I have a medical doctor who's training me and I have another educator who's training me. And then during that supervision time, you have to have a certain number of clients and you're always under supervision with your supervisor. And then at the end of that internship, you sit for an exam that's across the board national exam. So everybody has to pass that exam in order to become a practitioner. And all of that to say, that was really important to me. to have that standardization and that hierarchy and someone to, be answering to in a system that I can really believe in, because it's all evidence-based, it's backed scientifically. We have doctors that we refer to that are in our networks, and it becomes in my eyes, a very legitimate system. And when I tried other systems, when I had to do cervical mucus checks, I had no idea, like, they say egg white, what's egg white mucus? I have no idea. Am I seeing egg white? Is this not? Like, I don't know. And the thing that sold me on Creighton, honestly, is there's a picture dictionary where we sit down with clients and we show them a picture of each type of mucus, and it's given a specific name and a specific number. And I'm like, I'm sold. Now I don't have to guess anymore. I know what this cervical mucus is when I see it, and I'm good to go. So
have you seen clients that don't have any cervical mucus?
Yeah, so I'm glad you brought that up. So there are a few symptoms that we might think are normal, but really aren't. And one of those is no mucus discharge at all. And so you should typically have 5 to 8 days of cervical mucus discharge. And for some women, they're not having that, and they're having dry cycles. And we can look at that, and what that's indicating is you're probably not ovulating. You're not having an ovulation, and that corresponds with your hormones. And a lot of times it's associated with infertility. So in order to achieve a pregnancy, you have to have good mucus, you have to have good eggs, and you have to have good sperm. And if any one of those 3 things is missing, then you're not going to be able to successfully achieve a pregnancy and maintain a pregnancy. Some of the other symptoms is too much discharge, actually. So you can have too little or you can have too much. And a lot of individuals who have PCOD, they are having continual discharge and seeing continual discharge. And it also indicates that you may have your cervix is inflamed or something is going on that shouldn't be happening.
The doctors that you refer to, are they typically like gynecologist doctors? Are they family practitioners? What kind of doctors are they?
There are both. So in the area, we had 2 doctors. We just recently got a third that went through her training. So there are 2 doctors who are both gynecologists, I believe, at Magnificat, which is up at 86th and Ditch area. And then we have Dr. Holly Smith, who is through IU Health up in Zionsville, I believe, who is just a family doctor. Both or all of them are great resources. And so then if I'm seeing anything in the chart, then I can refer them to the doctor, and the doctor that can then run hormone panels and do any other checks that may need to happen. And also with charting, the neat thing about charting is a lot of times when you go to the doctor, a lot of women are familiar with getting a hormone panel done, even if they're not going to a NAPRO doctor. But traditional gynecologists do hormone panels just on average cycles. So we anticipate your cycle to be 28 days. So on day 8, we'll get hormones. On day 14, when we assume you're ovulating, we'll get hormones. And then on day 22, when you should have high progesterone, we'll get hormones. But when you're charting, we know that the majority of women don't have 28-day cycles. And so the doctor will go off to your actual chart to know when to do those blood tests, when to check those hormones, so that you're getting a really accurate read on that. So that's another benefit. And actually, a few of the doctors that are in the area all require that before they'll have their first consultation with the client, that they chart 2 to 3, about 2 cycles for each client before they come in to see the doctor, so that when you have your consultation, you actually have the chart in front of you, so that you can talk about things that are important, and not just, you can make a game plan.
Oh, good. We have a couple viewers. We have Erica and Irene. If you guys have any questions, throw them at us. We just have a few minutes left. How successful has been the Creighton method with pregnancies or avoiding them?
Yeah, so we have, it's for avoiding pregnancy is 98% accuracy rate. And when you start accounting for some user error, you get into the 96, 97%, which is great numbers. It's comparable to birth control without all the side effects, without all the bad things. And then when it comes for treating infertility, so couples who are struggling with infertility, with not being able to achieve a pregnancy, when paired with a NAPRO doctor, someone who's alongside the practitioner in your chart, we're seeing up to 80% success rates, which is extremely unheard of, especially in something like the IVF realm. Or, one of the things that sets NAPRO apart, Creighton charting apart from something like IVF, is with IVF and with a lot of traditional doctors and looking at something like birth control pill, they're bypassing the problems, what's causing the infertility, whether it be endometriosis or PCOD or whatever the cause is, they're bypassing that and just trying to achieve pregnancy. Where NAPRO is looking at the infertility or the symptoms as being disease-like, and we need to solve those problems. And when we can solve those, then you'll be able to successfully achieve.
That's awesome. As a chiropractor, I love it.
Yeah, it's great.
So are you taking clients currently? Like, can we put your information up here?
Yeah, I am actually, I have an introductory session scheduled for the 29th of November. So that's a Thursday evening. And that's a group intro. So I try to do one group intro a month. And if for some reason that doesn't work, then I do private intros for couples if they're interested. But I am taking new clients, transfer clients, and I will just speak really quickly on that. Since the whole method is standardized across the board, you can learn Creighton with one practitioner for a couple months. And then let's say you have an unexpected move or the schedule conflicts or something, you can easily transition to another practitioner because we maintain case management and we all teach the charts exactly the same. All of your information and charting and case management can be sent to another practitioner. And the same thing with doctors. Any of the doctors who are trained can all look at the chart, can all look at the case management, and across the board will know what's going on with you, which is amazing.
That is amazing. What's your website then?
So it is creatingspace.birthservices.com. And there is a schedule now button there, or just contact to get more information.
Okay. Great. We'll also add it in the comments after our live is done. Anything else you want to leave us with? Any tips for our moms or future moms?
Yeah, I think and this is becoming a huge word about empowerment, right? Everybody wants to be empowered. What does it mean? And I think mostly finding ways that we can manage our health on our own, whether that be with exercise, whether that be with chiropractic care, whether that be with our fertility, being able to take the power back for ourselves. And because we can have so much, and so each area you should learn as much as you can about that. So I'm passionate about fertility, but there's other areas too that, become educated, and it's worth it.
Good. Well, thank you so much. You were a wealth of information for us today. I learned a lot. I've heard of this method. We've had somebody actually come speak about it, and I continue to learn. I think it's amazing. The more we can do naturally, getting back to the basics, the better our bodies are going to be, and we're going to live longer and be healthier. So I really appreciate you coming on with us today, and we'll put the website in the comments section. So if you want to get a hold of her, you can. And again, have a happy Halloween. We will talk to you soon. Thank you.
Bye-bye.
Bye.